Hey everybody, Dan here with Pain Free You. So, today's topic is going to be, is trigeminal neuralgia TMS? I'll get to that in a second. I'll take a couple of breaths, get myself centered. It's a really important topic. Breathe in the peace, exhale the noise. Breathe in the clarity, exhale the uncertainty. Breathe in the bravery, exhale the fear. So, is trigeminal neuralgia TMS? Trigeminal neuralgia, also known as TN, is the medical label given to people with facial pain. And they talk about the trigeminal nerve, and has to do with sometimes teeth, has to do with ears and face, and sometimes it's one side, sometimes it's both, and it's absolutely one of the most significant chronic pain conditions that I've heard of, and I've been paying attention to this stuff for decades. And when I say that, it's because in that community people call it the suicide disease. And I really want to talk about this because I know of a couple of people who are struggling with this medical diagnosis. One of my past coaching clients has literally had 9 operations to her face and head to try to resolve this, and each one of those operations she has been promised a 95% chance of success. And yet she still struggles with this. She refers to an onset of pain as an attack. And, I witnessed it because I was on a Zoom coaching call with her a couple of times as she experienced this attack of pain. And it was really challenging to watch. And so, is trigeminal neuralgia TMS? Well, as evidenced by the fact that most of the medical community has not solved this problem, that to me indicates that if the modern medicine community and surgery is failing and failing and failing, there's probably something else going on. But I will say that within the TMS community, there are very few success stories where people use this mind-body process, this TMS type of approach to resolve their trigeminal neuralgia. And I don't think it's because trigeminal neuralgia is a real thing. It's a medical label for a condition that doctors cannot figure out what starts it and how to cure it, which is a lot like most of the other TMS type of symptoms. So why does this trigeminal neuralgia seem so much more difficult to treat as TMS compared to, say, let's say, back pain or shoulder pain or migraines, which to the folks in the TN community feel is trivial and nothing compared to what they're dealing with? And they're probably right, because they are experiencing excruciating pain. And I'm not going to share the message I just got from one of the ladies I know who suffers from this medical label, but it was very wrought with despair, frustration, fear, anger, rage, despondency, hopelessness. Feels like she's losing her mind. She feels like her brain is torturing her and punishing her, and and her messaging went all over the place. And justifiably so, because she is really, really struggling. So why does this trigeminal neuralgia seem so difficult to treat as a mind-body disorder? I will tell you this. Acceptance. In the TMS community, back pain, fibromyalgia, migraines, shoulder pains, knee pains, hip pains, all these things are very commonly spoken about in the TMS mind-body community. As a result, it's easier for somebody new introduced to this to say, you know what, they're getting better. I should be able to get better. And in the trigeminal neuralgia camp, people who have been given that medical label by the doctors say, I'm not seeing a bunch of success stories, so it must not work. But let's take a look at the ecosystem surrounding trigeminal neuralgia. Again, it's called the suicide disease because there's a lot of hopelessness and the pain is excruciating. And there's a lot of belief systems surrounding that type of pain. Cold makes it worse. Wind makes it worse. And these things are spoken about within those communities as if they are fact. Oh, and people are moving from Canada to Florida to get better, and they get better. Is that because the cold weather is bad for the nerves in the face? Or is it because there was a nocebo, which is kind of like the opposite of a placebo, a nocebo and a belief that cold makes it worse, so anytime you're exposed to cold, the brain goes, oh my God, freaks out, turns on the pain, and then it just confirms the belief that you've read about in the TN community that says cold is bad, I experienced cold, my pain went through the roof. Yes, that's true. Wind is bad, same deal. A wind hits your face, oh no, I heard wind is bad, ooh, the brain freaks out, pain goes through the roof. There's confirmation that yes, that's true, that's a fact. And this lady who I've become friends with over the past year and a half or two and have helped her out, she has had bouts of recovery. So last summer, 2020, she had a good time. She felt great for a few months. She even wrote a success story. But sure enough, as soon as the colder weather started to hit, she had, I guess, what could be referred to as a relapse of these symptoms. So, was that because the trigeminal nerves are literally irritated by cold weather? Or was it based on the mind-body concept that fear and attention drives the symptoms? So, I will tell you this. I don't believe cold has anything to do with it. People are exposed to all sorts of cold, and why would it just be this one facial nerve that is a problem with cold? I don't think the doctors have truly proven that this is a medical problem, because every treatment that they've ever tried to apply seems to fail and leave all of the people with this disorder hopeless. You know, again, 9 surgeries later. So the entire ecosystem and community in the trigeminal neuralgia camp is all about facts, hopelessness, fear, terror, suicide disease. There is no cure. We're not getting better. And even that mind-body TMS stuff doesn't work because, look, nobody's getting better. So for those people in that camp, I will say, I don't buy that. I don't believe that. I'm not telling you you're wrong. I am just telling you that your brain and your nervous system is so hijacked by fear and misinformation that a mind-body process that is really geared towards safety, soothing, comfort, you're going to be okay, it's just the brain creating these symptoms. It's much harder to get that through to a fearful brain that's been really programmed by this negative, fearful, hopeless society of TN suffering people. And I'm telling you, I'm probably going to get a little bit of hate from people who find this video online. But I will tell you, my understanding of TMS, it's driven by fear and attention. Well, in the trigeminal neuralgia space, there's buckets full of both. And there is hopelessness combined in there. And there is a belief system that certain things are very dangerous. Sometimes dental work kicks it off. People will have dental work that just doesn't seem to recover, and before they know it, they've got all sorts of pains. And to be very clear, for anybody who's new to my work, I am not a medical doctor. I am not a scientist. I'm a guy who basically had 13 years worth of pain. And yes, it was not trigeminal neuralgia. It was back pain and sciatica. And for the people who say, oh, I would trade that in a minute, you know, my pain was not completely disabling, but I had plenty of instances where my only best option was laying on the floor with my knees up looking at the ceiling. So I'm not comparing. There is no comparison. My pain was my pain. Your pain is your pain. I get that it's excruciating. And when you come from an environment like the TN community that is not seeing any success with surgery, medical treatments, nerve ablations, injections, you name it, and even the TMS community doesn't seem to work, I understand how you can get hopeless and fearful and feel like there is no answer for you. But to the lady who experienced a summertime with no pain, it's not because of the cold. It's because you started applying the concepts of recovery in a TMS approach, which is calming the fears, soothing, breathing, accepting that this is nothing more than the brain creating these symptoms. And this same person just had 3 weeks of feeling good. But then it came back again, and immediately, boom, back into the depression, fear, sadness, anger, rage, despair. This is never going away. This is torture, and all of that. And there's zero judgment here. It's 100% compassion for this person, and that's why I'm shooting this video. And I'm sure this person is not alone, but I will just throw this out there and see if it sticks. What other structural problem or disease process takes a holiday for 3 weeks? Remission? Remission of what? There's no medical test to tell if you've got TN. You know, it's not like cancer where you can see it on scans and blood tests and all that kind of stuff. What is in remission? In my impression, it's the feel-good confidence, it's the lack of fear, those things which are typical TMS approach strategies to teach the brain to settle down and turn down the symptoms, those work. So is the confidence in remission? Is the fear back? You know, the fear was in remission for a few weeks and the pain got better. You felt great. And so, to me, everything about this screams TMS, mind-body syndrome, nothing else. I don't buy the fact that this one particular nerve and facial type of pain is different from pain in the rest of the body. It's all controlled by the brain. It's all based on the brain's perception of danger. And if the brain's opinion is there's a lot of danger, it's going to sound this alarm called pain, because that's the only alarm system that the brain has to protect us from danger. So if it believes cold is dangerous and you're out in the cold, it's going to turn on the pain to say, go inside. If wind is dangerous, it's going to feel the wind and say, go inside, cover your face, do something. You know? And so, this is absolutely TMS, driven by fear and attention, and when you add in there a whole bunch of hopelessness, it's no wonder that many of the people that are struggling with this challenge are really in despair. So I will say, this lady is right. There are not a lot of success stories in the trigeminal neuralgia space. But so far, everybody I've talked to with that medical condition or that medical label has come to me with this perception. I'm different. My pain is worse than anybody else's. And there's all of this stuff. And I don't believe completely that TMS is at play here, which is all really feeding the fear that you're a special kind of broken physically. And when you are convinced that you are broken physically, Your brain has no choice but to respond with pain and symptoms, because the job of the brain is not to torture you and punish you and make you think you're going crazy. Your brain is your best friend, although you don't think that. Your brain has one job, which is to keep you safe and alive. It's been doing it since the moment you were conceived and starting to grow brain cells inside of your mom. That is simply the brain's job. It is an overprotective strategy fed by massive amounts of fear and misinformation. And if you can correct the fear and the misinformation and get clear, you can experience 3 weeks of pain-free living, or a summer worth of it last year. And if you can do that and maintain the confidence, the clarity, the turning down and dialing down of the fear, and also teaching yourself that the other danger signals are not bad. Because this lady shared that there was some issues, concerns with her daughter, there was relationship things. She can't really speak to friends or family about it because they just don't want to hear it anymore. They don't know what to do for her, so they kind of keep her at arm's length. That's not her fault. That's not their fault. It's just the way it is. They don't know how to help her. They feel hopeless and helpless to help her, and so that strains relationships. It's nobody's fault. It's the way it is. So she had a number of other things. She had a great 3 weeks. She was feeling really confident and great. And her symptoms were what? Leaving her alone. They were gone. And then some other danger signals came into the mix that started to have the symptoms return. And when symptoms return after you're feeling good for a while, it can really throw you. And what does it do? It immediately throws you right back into doubt, fear, worry. That was just a fluke. It was just a remission. It's never going to leave me alone. It's going to go away. It's going to come back, go away, come back. But I'm never, ever, ever going to be rid of this. And these are her words, not mine. But you can understand how this happens. And so consistency matters. What's within your control? How you choose to respond to the symptoms. How you choose to perceive them. As long as you perceive that there's a body problem, the brain's always going to keep it going. You got to get really clear. In my personal opinion, again, not a doctor, not a scientist, but as a guy who's been paying attention to and studying pain and TMS for about 24 years. I coach hundreds of people a year, got a group program, about 40 people in it right now. This stuff works. I don't believe TN type of pain is any different than any other type of pain. It's based on the brain's perception that there's something dangerous and bad going on, and we need pain to be the warning signal to go, you're in trouble, do something. I don't think it's any different. It is more significant and severe. It is in a part of your body that, wow, it is especially disturbing. But I will tell you, an equally challenging part of the body is pelvic pain. Men have it, women have it. It affects sexual function, and even just bodily excretion function, urinary, defecation, all that stuff. So there are other things that are equally traumatic to experience, which are also challenging. But in that space, there doesn't seem to be this despair that it's not possible. There are enough people with pelvic pain that have gotten better that others are starting to say, well, if they did it, I can. Unfortunately, in the TN space, there's not too many people that I know who have gone through it. And if you are watching this and you are one of those people who has used this mind-body concept, this TMS approach to get rid of your TN, please comment below. Please reach out to me if you're willing to share a story. Please get on the Zoom call with me. We'll record it and we will share your experience. What we really want to do here is get a movement of people who are buying into it, getting results, sharing their story, so that this TN community that is full of despair, fear, misinformation can start to see that it is possible to get better through a Mindbody approach, which is all about accurate information, calming, soothing, and settling down this brain and nervous system, which is just jacked up on fear and misinformation and despair. So, that's my take on trigeminal neuralgia. Is it TMS? My personal belief is yes. People will argue with me. Some people will say, no, Dan, you're wrong. Let's have a healthy dialogue. And if there are people out there who are upset by my thoughts in this regard, let's have a discussion. Let's see if we can get some people better. And let's see if we can then share that success. So if you are one of those people who has utilized this Dr. Sarno mind-body concept TMS approach to get rid of your medical label called trigeminal neuralgia, please reach out to me. Let's talk. Let's get it on video. Let's share it, because the TN community and ecosystem desperately needs some accurate information and hope that this is not a lifetime sentence to torturing pain, that there is a way out, and the TMS approach is that way out. I believe that with all my heart. I don't think it's any different than any other type of pain, other than the fear surrounding that diagnosis and the misinformation and perceptions that certain things are dangerous. So there's so much fear there, so there's so much misinformation. But yet, I think pain is pain regardless of where it is. And so I think you can get better. I know you can get better. And for this one lady, you proved it for 3 weeks recently, and you've also proved it last summer for a couple of months, few months. Physical symptoms don't go on vacation. They don't take breaks or holidays. When you're feeling more optimistic and happy, and when things start to turn in other parts of your life and the pain comes back and you freak out, nothing happened physically. You didn't fall off a ladder and land on your head. And I'm not saying that in a mocking way whatsoever. I am trying to make a point that nothing changed physically. The only thing that changed was belief, mindset, optimism, soothing, calming, and the reduction of fear. And if you can take the fear from up here down to here and shift your attention away from this medical diagnosis to living your life, smiling, having some fun, take away the fear, take away the focus, and the symptoms can come down. When she started getting stressed out with other things in life and the symptoms started coming back, I can virtually guarantee there was a lot of fear and a lot of focus and worry that, oh my God, it's back. Oh no, freak out. And it went back up. That's all that happened. It's TMS, in my opinion, 100% TMS. And so please, for this lady I'm referring to, please watch this again and again if you need to. For anybody else with this medical diagnosis, I believe there's hope. I believe there's help. Dig in. Read a Sarno book. Join my group, painforyou.com. Look for the course and membership link at the top. The concepts I share will help you. And the fact that it can go away is proof that it can go away permanently. The issue is it came back, and instead of reassuring and soothing and calming, unfortunately, very easy with this type of pain to slide right back into despair and hopelessness, and the belief system that says this is never staying away. So, with all that said, love you guys and gals. That's my take. I'm sure there's going to be some differing opinions out there, so let's have an adult conversation about it. And we'll see you guys and gals tomorrow. Take care.